Okay, my name is Sharonda Coleman, and I'm here with Miss Joy, and I'm getting ready to have a counseling session. Okay, how you doing today?
I'm fine. How are you?
I'm doing well, thank you. Okay, what brings you in today?
Um, I've been having a little bit of stress about my mother.
Okay, you've been having a little bit of stress about your mother.
Yes.
What type of stress are you having?
Um, well, I am her caregiver, and um, there are times when she gets very ill, and I have to make some choices about her care now.
Okay, so you're your mother's caregiver, and you're saying you have to make some choices about her care. So, how long have you been her caregiver?
About 8 years now.
Okay, so about 8 years, so a pretty good long time. That's my hats go off to you. That's a really huge responsibility. So, how is that making you feel?
Um, it's making me feel a bit stressed out about the next decision I have to make.
Okay, when you state the next decision that you have to make, what are you referring to?
Because she's getting older, and her health is good, but at times it's kind of waning a little bit.
Okay.
So then I have to now. It's more often that it's waning, so I have to now make some choices on what action do I take. She doesn't want to leave. I think it's time for me to make some decisions. For the most part, she is in good health. It's just those times when she
Get stoned.
gets some type of illness, like when she gets a urinary tract infection, UTIs.
Okay.
Sometimes they kind of make her. Um, she's kind of out of it a little bit.
Okay.
So. Um,
Well, those UTIs can really take a toll on anyone's body, especially us women, because we have other female hormonal issues that occur. But with this stress, how is it making you feel as far as yourself is concerned?
well, with couple with my job, couple with this, and just other personal things, I think that it's adding to some stress that I already had there.
Okay.
And so,
So, what have you done in the past to alleviate the stress?
um, typically I wait it out, and it's better for a time, but now it's something that's kind of pervasive, and it's not really uh, leaving me.
Okay. So, since it's not leaving you, then what have you done to try to resolve the issue? What steps have you taken?
I've been in touch with other relatives that would be willing to uh, have her in their home.
Okay.
Since she doesn't know anyone here in this town. We're not from here,
Okay.
so I don't want to just put her somewhere here that she doesn't know anybody. But um, my other relatives have been very welcoming to allow her to come back, to go back to where we're from and stay with them.
Okay. So, I know that is a huge step. That'll be a transition from you because it will go from you seeing your mother every day to you maybe only seeing her on the weekend or maybe 2 or 3 times a month. Are you comfortable with that?
I am. I'm concerned about her because she's an older person who just really doesn't want to make another big transition like that again.
Okay.
Even though it's back home, you know, I think that, you know, she kind of got used to a way of life
Okay.
here. And, you know, I'm fair but firm with her about the choices she makes about her food, the food that, you know, she wants. And I don't think she'll have that control back home on her own.
Okay.
And I don't know if anybody else would respect, you know, what I've been trying to help, you know, the health consciousness I've been trying to drill in her head.
Okay.
I don't think that they will be, it will be as, you know, thought out.
Okay.
So I'm just a little concerned about that.
So, with you knowing all those things and those are your concerns, meaning that your mother would have to stay with someone else, have you thought of maybe having those relatives come to her environment instead of you guys taking her out of just what you said? She's made herself at home here. She doesn't want to necessarily go through that transition of setting up life in Louisiana again because she's already gotten accustomed to the Houston way of life.
Well, I know that asking someone to come here would be a big stretch. I have a relative that he, you know, wants to come and everything, but I don't want to put that burden because he's not coming here to do that. He's coming here to start his own life.
Okay.
And so the relative that I was thinking about her moving in with would be her sister.
Okay.
And they're like a couple of years apart.
Okay.
So they have more in common. You know, they're sisters.
Mm-hmm.
They're age appropriate for each other, and I think that they'll have more to kind of lean on each other with, you know what I mean, like the ailments and the different things. So there's things that she's an older parent for me. She had me at an older age. There's things I can relate to her with, but there's other things I can't.
Absolutely.
And you know, and but I think she might be better with a relative who is more inclined to understand her needs and her, you know, her different, whatever it is she's trying to.
Yeah, different elements.
Right, and also just I don't know. I think they'll be a better fit. I mean, I just, I don't know. I think also, too, somebody's going to be there if she gets sick. Somebody's there with her.
Okay.
You know, took care for her all the time. Whereas I work. So it's a little bit more challenging for me to be there with her all day if she has some issues. Right. I mean, I did take her to the doctor. We get medicine and she rests. But I think it'd be nice to have. And sometimes I'll take time off with her, you know, like I have a second job, so I might not work the weekend.
Okay.
To, you know, help get her back in shape if that's the case. But it's just now, like I said, things are more frequent now.
Okay.
It's happening a little bit more frequent. Not as frequent. It used to be this frequent.
How old is she?
She's 80.
Okay, so she's pretty up in age. You know, it's a blessing for her to be that old. So have you looked into maybe having her a home health care provider or maybe someone coming in, you know, because a home health care provider, if they could help you out with meal preparation, cleaning up, you know, whatever